Do you have a bunion and want to avoid surgery? Does your mum or father have a bunion and you want to avoid feet like them? Make sure you check out this video. I'm going to take you through some of the great feedback we've recently had about our bunion treatment, how we can help you avoid surgery, some simple things that you can get started at home, and next steps if you want a professional opinion on how to treat your bunion and avoid the need for surgical intervention. My name is Daniel Fitzpatrick from Sydney Foot Solutions. We see about 150 bunions a week. We see stacks and stacks of them. And I wanted to share with you guys a recent review we've had. A wonderful person named Kylie came to see us and she wrote in our review section. If you want to check out the reviews, go to sydneyfootsolutions.com.au or go to Sydney Foot Solutions Reviews. And Kylie wrote, "There is a definite improvement in my bunions. Great service." And so we're really grateful when people give us a positive review, and we're grateful that people trust us with their health and with their bunions. And so thank you very much, Kylie, for giving us that review. Now, I won't say anything too specific for Kylie, but needless to say, Kylie is reflective of a large amount of people that come to see us for their bunions. They're very busy people. They don't have the downtime that you need for surgery. They need to treat their bunion effectively as soon as possible without having to go through the cost, but also the downtime associated with bunion surgery. Keep in mind that you tend to be in a boot for at least 6 to 8 weeks with the bunion, and before the swelling stops, it can often take 6 to 12 months, because at the end of the day, surgery is a pretty big deal. What we do find regularly is that people sometimes aren't sure why they're getting a bunion. So the reality is that you tend to get a bunion because of a level of misalignment in your foot and ankle. And that misalignment in your foot and ankle is the thing that you inherit, and that affects the way you stand and the way you walk, and then that leads to a bunion. And the good thing about that is you can actually do something about it. You can help it a great deal. Because of the way you stand and the way you walk, it starts to turn off those foot muscles through that particular area there. And the good news is you can actually turn them back on. I'm going to show you a couple of things today where you can actually start to turn your foot muscles back on. So make sure you watch through to the end of this video. And the other thing I would also say is if you want some professional advice around your bunion, make sure you check out the link below. We're offering a 60% initial assessment offer for people with bunions, where you can come in and get your bunion checked for just $40. So make sure you check out the link below or go to sydneyfootsolutions.com.au, sorry, had a bit of a stumble, where you can check that out. And so what I would say is that one of the really important aspects that people overlook with bunions is keep in mind a lot of people with bunions, their foot muscles through here aren't actually turning on. And the difficulty with that is that because they're not turning on, they affect the way you stand and the way you walk, and they cause you to internally rotate and affect that aspect of it. So I'm going to show you a really great exercise you can do at home. All you need is a bath towel, and I'll show you how to do this. Now, it's really quick, it's really easy, it'll take you 1 minute a day. So you get yourself a towel, and the purpose of the towel is to flex your big toe, all right? So you really want to flex your big toe. And so what that does is, you flex your toe like, and you just go up and down, all right? And what this is doing, by flexing the big toe, the research shows that you are turning on all of your foot and your ankle muscles to turn on those tissues around the actual arch and the ankle area. And by doing that, it turns on those tissues and it starts to interfere with that process that's associated with a bunion. Another one you might like to try is to actually turn on a muscle called adductor hallucis. Now, adductor hallucis is a muscle in here that helps to straighten out your big toe. The reason we show this is because most bunions have some level of deviation through the big toe, where you're getting a deviation like that. And by turning on this muscle, it helps to pull the tissue back. And so the way you do this one, go back here and demonstrate, is that you put your finger in here, you push your big toe down, big toe across, and then use your big toe muscles to push down. For the first couple of weeks, you'll probably need your fingers to do it. So you just pull it across and push down, and you should feel the muscle firing in this area here. And so by doing that, what you're actually doing is you're firing those tissues and strengthening all the muscles in this area here. And what we find is that, let's put it this way, if adductor hallucis was doing its job, you wouldn't have a bunion, because adductor hallucis helps to turn on these muscles and helps to strengthen them back into a better position. So 2 really great exercises, and we use these heavily with a number of our bunion patients, and we've got really good results. And we've used both of these exercises for about 20 years. We've updated the versions of them as you would hope we would, but they're 2 really great things to take away points. So what I would suggest is, why don't you have a go at those? Keep in mind, if you want extra help for your bunion, make sure you check out our special offer, 60% off for the time being. Keep in mind though, when you are dealing with a bunion, the sooner you get on it, the more options you have, and the better the long-term outcome when it comes to conservative management. What we do find is, if you leave it too long, people are very disappointed when they leave it too long and they come and see us and we tell them that their only option is surgical. Keep in mind, we can't help you as much as we would like if it goes too far and it gets over 50 degrees. So I would strongly suggest that you take us up on that offer of our special bunion offer. Make sure you check it out. Go to sydneyfootsolutions.com.au or click on the link below and claim your 60% off your initial assessment.